Hi everyone, my name's Damien and I'm one of the health trainers from the Wellbeing Service for Blackburn with Darwen Council. I just wanted to spend literally a couple of minutes on this video and just give a brief overview of Mental Health Awareness Week and what it means to me. And I'm hoping that off the back of this video it kind of encourages any of you to reach out and just seek a little bit of advice or a friendly chat or whatever it is you want to take away from it, especially with everything to do with COVID-19 and lockdown and the new normal and all the rest of it. So I was just wanting to take a couple of minutes just to let you guys know how I've adapted to lockdown and kind of what mental health means to me and how I cope with it. First of all, mental health, everybody's got a mental health, whether it's a good mental health or whether it's a not so good mental health. And there are there's quite a lot of stigma around mental health, and the idea behind little videos or government campaigns and things like that is that it's good to talk, and there's nothing to be ashamed of whatever type of mental health you've got, but it can always help by discussing and talking, which is the purpose of the video. So since lockdown, since like mid-March, what's really helped me with my mental health is to try and stick as much as I can to routine. Other than my role as a health trainer, I also have a role as a freelancer working for Blackburn with Darwen, where I teach group exercise classes out of the fitness facilities. And a lot of these classes are before work, so early doors, 6:30, 7:15, before my day job starts. And obviously I've not been able to do that because of social distancing and the gyms being closed and what have you. So I kind of took it upon myself to stick to routine. So on a Monday morning where I would normally teach my body balance class, or a Tuesday morning where I would normally teach my body pump class, and so on and so forth throughout the week, I'm still getting up at those times, maybe a little bit later. I don't have to travel, so I don't have to factor in the travelling time, but I'm still getting up on time and I'm still delivering the class at the time that it would be scheduled at the leisure centre. Therefore, sticking to routine. For the first couple of days when we started communicating with the rest of the team, a couple of my colleagues, they were saying via our Microsoft Teams meetings, they were like, "Oh, you've got your uniform on," or "You've got your badge around your neck." And we had a bit of a giggle about it, and that was quite cool. And when I asked why, there was one or two of them that said, "Well, why have you put your uniform on?" And I'm like, "Well, I like to stick to routine. This is my job. I get up, I put my uniform on. I've even put a little bit of aftershave on today. Just that's kind of what makes me happy. That's what suits me by sticking to routine. Don't get me wrong. I'm not afraid of new routine or change, as long as there's structure. I still prepare an evening meal as I would do, and if anything, I've probably factored in sleep a heck of a lot more than I normally would. And this might sound like a little bit obsessive, but I've actually started setting myself an alarm to remind me for when to go to bed, because I'll admit it, I can quite happily sit up till the later hours and watch mindless television, just because I think, right, no, this is my time. I've done my classes, I've done my workout, I've done my daily routine, I've done my job, and this is kind of my time now to wind down. And then before you know it, you look at the clock and it's like after midnight, and then you wonder why you don't feel so great the day after. On a national average, an adult in the UK needs between 7 to 9 hours sleep, depending on their job, their physical activity, what have you. Now, when we go to sleep, you don't necessarily fall to sleep straight away, and then you need time for your body to adapt while you're sleeping. And if it doesn't adapt in the right way, the following day you can feel cranky, headachy, maybe even a little bit poorly. You don't feel well rested, therefore you're not kind of prepared for the rest of the day. And the more you do that, the more that has a knock-on effect of your usual routine, especially while we're in this new norm. And of course, if that then has an effect, your mental health then becomes affected. We don't sleep well. The reason we don't sleep well is because we haven't got enough sleep. Therefore, we start to cut corners with things like the types of food that we eat. We start to eat what I call kind of grab and go food rather than something a little bit more nutritious. So then our diet starts to fail and we start to slowly pick up bad habits. So kind of the idea behind this is let's try and not pick up bad habits and kind of retract it back to where it should be. So I was telling you about an alarm I set myself before I go to bed. So I normally set this alarm for about 9:15, and that gives me plenty of time to be in bed before 10 o'clock, to brush my teeth, have a wash, get ready for bed, sort the dog out, make sure the house is locked, maybe empty the washing machine or the dishwasher or whatever it might be, you know, just so I can kind of prepare everything in the home ready for the following day, and I can go to bed and I can feel relaxed. Another thing that I tend to do when I go to bed during this time is I use my phone as an alarm, but I try not to have it next to the bed, because I find that, and it is normal to kind of reach for it and have a quick check through social media, or, you know, see who that message was off or respond to whatever. But one thing I've started asking myself over the last kind of couple of months is that really necessary? It's probably more than likely going to be something that can wait till the following day. And if you're, let's say for example, you're a carer for you know, a family member or a parent or grandparent or whatever, and you think, well, that's all well and good, but I need my phone on in case that person needed to contact me. Well, that's cool, because I do exactly the same with my parents. There's actually a facility on most smartphones where you can mute your phone other than that person's number. So if that person was to ring you, even though your phone's on mute, your phone would still call, or your messages would still ping if they're off that person. So that might be worth checking out if that's something that you're a little worried about. But in terms of mental health, good sleep, a well-balanced diet, social interaction as well, which I know is really difficult at the moment. Things are starting to relax just a little bit, but it's still relatively difficult. So over the last kind of couple of weeks, I've reached out to friends on social media where I've said, okay, I get 30 to 45 minutes of lunch Monday to Friday. Let's arrange a coffee or a catch-up. And those people have either messaged me and gone, oh yeah, I'll have one, or yeah, we'll join you. And before I know it, I've got like 2 or 3 people on a Zoom call or a FaceTime call, and we're all sat there eating our lunch and saying, oh, you'll never guess what happened at work, or how are you getting on, or that sort of thing. And although it's kind of distanced, it's still bringing you together with somebody else. I'm not saying that'll work for everyone, but that's certainly worked for me over the last couple of weeks. I've met up like over social media with family, friends, even colleagues that I would normally see in and out of the buildings that I don't necessarily work with. So that's been quite nice as well. But the be-all and end-all of it is, it's generally really helped me mentally for my well-being, and it's kind of kept a smile on my face as well. So if you feel like you're struggling with anything in regards to like mental health, or even lockdown, or, you know, struggling if you're working from home, it might be worth getting in touch with the Wellbeing Service, or even the new Health Hub, the Help Hub even. And all the details for these can be found on the Refresh website. You can self-refer, or you might even be referred, possibly not so much at the moment, but you can actually be referred by another professional or a medical professional, but there's nothing to stop you from re-referring yourself. And you know what? If you get to it and you think, actually, just that first chat has kind of seen me on my way and I'm in a really good place, then that's fine. If you need a little bit longer, then you can have up to 6 or 7 appointments with one of us as a health trainer, and we can help you kind of get back on that happier path. Yeah, and I think that's all really. I hope it's helped, and let us know what you think. As I said, my name's Damien and I'm a health trainer for the Wellbeing Service, and I hope you've enjoyed this video. Take care.